Okay, by now most of you know I am 37 years old and I'm going to be having a bilateral hip replacement. I'm inviting you to follow along with my story. In this video in particular, we're going to be going over the nutrition. What's my nutrition been looking at like leading up to surgery, what it's going to be like afterwards in order to optimize my outcome with the bilateral hip replacement. My name is Dr. Andy Johnson with AJ Physical Therapy and Performance. Let's check in with registered dietitian Jennica Johnson.
My name is Jennica Johnson. I'm a registered dietitian nutritionist, and I will be in charge of Andy's nutrition plan pre and post surgery. Andy is my husband of 13 years. My plan for Andy pre-surgery would definitely be to help him with mitigating as much atrophy, muscle atrophy, as possible. Andy's body tends to lose muscle mass easily because of his metabolism. It's insanely fast. We're all jealous of it. But he will just lose muscle if he's not active or if he's not eating enough calories. So we're really going to try to start with a higher baseline prior to surgery, knowing that he will have some atrophy or some muscle loss in this process.
Okay, so you heard Jennica talk about this idea that I have a hard time putting on weight. I do have a really high metabolism and it continues to remain high into my mid-30s. So one thing we learned from some of the past surgeries is I tend to lose quite a bit of weight and muscle mass because of my lack of activity and lack of lifting weights, and I also tend to not eat as much as I should during those times. So we're prepping for that this time. So part of this nutrition is going to be, we're going to try to put on some poundage via my nutrition in order to try to make up for that loss that we know I'm going to have. So what is that going to look like? The numbers aren't exact, but we're really been shooting for an uptick by at least 700 to 800 calories per day based off my normal day-to-day diet. So 8 weeks prior to surgery, weighing in about 175 pounds. My hope and goal is to be 185 plus as I am wheeled into the surgical room to start the surgery. Let's see what happens.
Some other goals for Andy's diet plan before surgery would be to really focus on less inflammation in the body. As we know, inflammation happens with trauma or any kind of really hard thing that happens to your body, which is gonna be with this surgery. And we can minimize inflammation by the types of foods that we're eating. We can also eat foods that promote lower inflammation so that he can heal as quickly and as safely as possible. One of the biggest ways to reduce inflammation is to make sure your ratios of omega-6 fats and omega-3 fats are optimal. And Americans tend to have too much omega-6s and not enough omega-3s, which is omega-6 is pro-inflammatory, omega-3 is pro-anti-inflammatory. So we're going to try and do things more like a plant-based omega-3 supplement, chia seeds, flax seeds, walnuts, greens, things that are going to have more of those pro-anti-inflammatory markers. Andy is vegetarian, and sometimes most of the time he prefers to be as vegan as possible as well, and that is how we eat in our home, so it's not anything new, but we do have to be more intentional about getting enough protein in his diet, specifically arginine, which is one of the amino acids that is one to be known to aid in wound healing and just healing inside the body in general. So when we're focusing on those things, I will be packing the foods in. I know most things with higher arginine are usually supplemented, and we're not opposed to that either. But getting enough protein and all the essential 9 amino acids that you can't get unless you are eating complete protein foods, and in plants that gets a little tricky, but it's kind of my specialty. So we know which ones to do, specifically things like brown rice and black beans. We do things like bean-based pastas, so that we can eat a normal meal with the family, but adding more proteins in general. Luckily, Andy likes tofu, so we can do that as well. Tofu is a complete protein because of the soybean. So there are specific ones that we will focus on. His protein needs do go up a little bit during wound healing and just healing in general in those first 6 weeks. And so we will focus more on getting protein in, but it's not astronomical. It's maybe from like a 1.1 gram per kilogram to about 1.3 or 1.4. So it's not astronomical, but it is an increase in wound healing.
All right, so Jennica brought up the fact that I'm vegetarian, and we wanted to make it clear that this isn't the only or best route to do pre-surgery. If you've been eating a certain way and you're trying to make a drastic change like that, make sure you connect with a registered dietitian to help you make those changes and decisions. I've been vegetarian for a very long time, and so this transition has actually been very easy for me. Really, the hard part is, as I alluded to earlier, we're stacking on a little bit more calories. So if you have interest in that, great. Make sure you connect with a registered dietitian. Otherwise, don't feel like you have to go vegetarian in order to prep for a surgery like this. This is just the way I've already been eating for a very long time.
With getting enough calories and protein in anybody who's vegetarian, mostly vegan, but Andy does fall in this category, is vegetarian food has so much fiber and it fills you up, and it's hard to get that food in to meet those goals just because it won't fit. I'm not against blending. I'm not against getting a smoothie or fortifying like we talked about a pasta sauce, so that the pasta sauce and the noodles also have protein. So if we have to blend it down to make it easier to ingest in a more concentrated amount of food, that's all right. This is actually going to be my second time helping him post-surgery. I did help with one of his other surgeries, and he's a really good sport. He doesn't complain, but I'll have to keep on top of his medications and have to read between the lines when I ask him if he's okay or if he's in pain, because he won't admit it, but I'll have to just get it out of him. One thing that could be a little deceiving is that what I'm saying for Andy, you might want to do it for yourself. I've known Andy for a very long time, and I know what works best for him and what he needs, what his needs are, his metabolism, his body type, all of that. So if you have any questions or you're wondering what grams of protein you need or calories you need, please be in touch with a registered dietitian nutritionist who will have that conversation with you and will figure out what your needs are based on your lifestyle and your current health situation.
Okay, so just to recap, the main goals going into surgery are, for me in particular, to try to put on a little bit more weight and really control the weight, so we can call it weight control leading up to surgery. We're going to try to control inflammation, so using nutrition to try to keep inflammation down as much as possible. We didn't talk too much about this idea, but also using nutrition to keep my immune system as high as possible, staying healthy leading into surgery. And then of course the big one is the protein really helps with healing as we're recovering from surgery. So we're going to make sure we're getting enough of, in my case, plant-based protein in order to recover well and maximize my rehab post-surgery. Okay, so I hope you enjoyed the video on some insight on the nutrition plan leading up to a bilateral hip replacement. If you have any questions, thoughts, or concerns, please leave it in the comments below. We would love to see your thoughts and would love to respond to as much as we can. In the meantime, please, if you haven't already, make sure you subscribe. It helps us reach out to more people so that we can help more people through this process, and hopefully you continue to watch and observe along with my story as we prepare for a bilateral hip replacement.